I want to thank the congressional members once again for taking the time to share their viewpoints with us. Before we get started with the panel, I want to encourage all of you to use the hashtag #FoodTank across all social media channels to share your thoughts and your questions and critiques with us. We really want to hear from you. So thank you to our online audience who stays really engaged during a lot of these events. And I'm so excited to continue this conversation about how the private sector can continue integrating nutrition and health and everything that they do, because they have such a power. So I'm pleased to see all of these panelists. And Pam, I like starting with you. Because you and I have talked a lot about this, and you've mentioned that there's a real interest in food as medicine from healthcare professionals. But there are a lot of barriers for helping them do more of it. We talked about education before. A lot of them don't have the education, but they understand the power of food as medicine. How can we overcome these barriers?
Thank you. I just want to start with saying that I've had a permagrin all day. It's so exciting to be here and to hear all the repetition of the panels. And there's so much communication to healthcare. So as healthcare, thank you for all of that. And just to start with saying, there is so much enthusiasm in healthcare right now for food as medicine. So from our members and our patients, maybe backing up a second, I'm from Kaiser Permanente, which is an integrated health system. We're at 12.7 million members across 8 states in Washington, D.C. And what integrated means is we're both health insurance and providers. And so I want to say that so that you can hear what I'm saying in the context of both health insurance and providers. So much enthusiasm from our members and our patients, and also from our clinical colleagues. It is not abnormal for me to get a email or phone call on a regular basis from physicians who are on the front line, or physicians or the care teams on the front line saying, we need this, and we need this now, because they're seeing what we've been talking about today on a regular basis, the diet-related disease in their patient population, and they're saying, let's get into traffic here. To your question about what are the barriers, I think it's very clear that there is more and more, food as medicine is rapidly increasing inside healthcare. That is happening. It's also clear that if we want this to get into the fabric of healthcare, we have to continue to build the evidence about what works and under what conditions, and the business case inside healthcare, so that we can scale this and so that we can sustain this. So to me, those are the biggest barriers. And then we have other barriers like workflow and burnout and all the things that have been said also throughout the day. But the biggest ones are, what should we be doing, to whom, which patient populations, which disease categories, for how long? And once we can do that and be able to communicate that and get that into our plans and our budgets, it's a whole new day.
I want to come back to this idea of building a business case in a minute, but you mentioned enthusiasm from not just healthcare professionals, but from patients, and I'd love to hear a little bit more about that.
So so we've been doing food as medicine in a lot of pilots, and the patients in those pilots are super excited about what was talked about on the last panel. So like a farm box being delivered to their doorsteps with healthy food for them to make dinner, recipes that tell them how to cook it. For patients we just finished actually a study, a randomized controlled trial, because that's also what matters inside healthcare, is making sure that we're doing the most rigorous science. And so these patients participated in this. They were diabetic patients with Medicaid, mostly with Medicaid, and we sent boxes of healthy food, mostly produce with a couple of other healthy items, to their homes once a week for 6 months. And the enthusiasm of those patients was just amazing. We've been doing studies, also randomized controlled trials with medically tailored meals, also enthusiasm from those patients. So we're starting to get into traffic with the pyramid, basically. We have all levels of that pyramid going in pilots, or sometimes in full force for SNAP. We have SNAP enrollment going on. We've helped almost 125,000 members enroll in submit their applications for SNAP. And what we learned from that is that healthcare has a role to play in that. Our patients want us to help them there. And then when we help with SNAP, we can also help with other government programs, like helping people with their internet, also WIC. And so we're starting to take a look at how can we be a good partner to our
Yeah.
patients in getting them enrolled in government programs and getting them to be able to participate in food as medicine programs.
And that's really the key. How do you become a partner with folks? And so, Gordon, if I can turn to you and sort of keep going on this idea of produce prescriptions. For those who might not be as familiar, can you talk about how Stop and Shop is using produce prescriptions?
Sure, we were the first in Massachusetts to adopt or to work with Fresh Connect, and that's been really successful, and we continue to grow with that. We've actually, in Montessori Hospital down in the Bronx, we've actually sponsored a trial where we're actually providing the finance to for the experiment or the trials to take place. And so we're absolutely committed to that. You know, we think that obviously retail in grocery stores are a key part in the food world, and you know, we've taken journeys over the years to get to reformulate private brands, reformulate product, and as you sort of progress, this food as medicine becomes really exciting, because I think there's been a progression. I've been in the States 10 years, and we've gone from food banks just taking any sort of foods and sugary drinks, etc., to actually setting standards that they want to have food, or the quality of food and healthy food. And now we're getting to this stage where we really are sort of, how do we sort of reach out and serve people and deliver? And Fresh Connect and the food produce prescriptions really is fundamental to it, and a great example of food as medicine.
Yeah, and it's about those partnerships. You have to keep partnering and finding different ways to partner. Chef, if I can turn to you, Boston Medical Center shares recipes on their website contributed by Nubian markets. And I love this because you're providing a lot of diversity, not just in terms of, the diversity of foods, but the sort of diversity of thought around food. And I'm wondering if you can talk about that.
Yeah, so we didn't just partner with BMC on the recipe side. Mike, all right. Is that better now?
That's great.
All right, cool. But no, I got to say, they didn't just partner on the recipe side. It really was building this thing from the ground up with the community to actually create the food as medicine that we want in our communities. And recipes is one small chunk of that. And so what we did is we worked with BMC to ensure that investment went into creating business cases that could be scaled up from the ground up from a grassroots reality in Nubian Square. And the recipes show up so everyone in Boston can actually celebrate the collective diaspora from our perspective of what we say is medicinal to us, given the recipes that we design in collaboration with Boston Medical Center. So they're allowing us to take the lead, sharing our intellect and our creativity. So we're not just looked at as a group of patients, but we're also looked at as a very diverse group of people with different talents to actually center the narrative differently around food as medicine.
It's so great. And that narrative has really needed to change for a long time, because not everyone has considered food as medicine, but chefs have been at the forefront of this. And I'm wondering if you can talk about that a little bit more.
Yeah, chef has been on the forefront of creating the tastiest burger that is not medicinal, unless you look at it as I just want to go get a burger and celebrate with my family, which of course is medicinal as well too. But yes, we also are at the forefront of trying to make sure that we're working directly with farmers. And at Nubian Markets, we center Black farmers as that reality, so we can talk about sovereignty both on the land side and the consumer side, so people can choose what they would like to see, and then we can collect the data at the grocery level to say this is working, this is not.
Right.
So that's kind of the interplay that we kind of sit at.
And again, it's building the business case, which
Yeah.
is so important to all of this. Gordon, if I can turn to you and talk about. Sorry, I want to go to Brooks next. What role do you think that insurance companies have in incentivizing healthy eating?
Sure. First of all, great to be here and represent John Hancock, a 161-year-old company operating a few blocks away here in town. To me, it's really odd that our industry and our business has not been at the table on these important matters. If you know anything at all about how life insurance works, you buy a policy, we collect your premium, we invest those premiums, hope you live a long time, and then when you die, we pay the death benefit to a loved one, presumably. So the longer you live, the more money we make. I'll be completely blunt about that. But despite that really simple, basic fact, for literally hundreds of years, our industry issued life insurance policies on people and sat back and said, I sure hope they live a long, healthy life. and did absolutely nothing to try to achieve that outcome. So in 2015, we introduced a first-of-its-kind program that incentivizes and rewards our customers for taking steps towards a longer, healthy life. I won't get into it all here in the interest of time. You can do a search on John Hancock Vitality if you're really bored later. But it's basically an app with incentives and rewards. Anything you do that correlates with longevity, physical activity, good nutritional choices, preventative screenings, you get points. Those points accumulate, and you get a status, sort of like you would on an airline or something, bronze, silver, gold, platinum. The higher the status, the larger the premium discount is that you enjoy on your life insurance premium, and the greater the value of a whole bunch of other rewards. So we launched this program in 2015, started it with a really heavy emphasis on physical activity. Unfortunately, we learned quickly, as I learned, you can't exercise your way to good health at some point in life. Nutrition really, really matters. So we went out and looked for a partner. We found the great folks at the Friedman School and added a heavy nutrition thread to our program. And I'll just give you a couple examples of how we've tried to commercialize this in what we think is a perfect sort of shared value situation. Sometimes customers don't do things that are good for them and good for us because what we'd consider the right choice is a more difficult choice. In the case of nutrition, for reasons I'm sure everyone in the room understands well, sometimes healthy foods are actually more expensive than unhealthy foods. So we partnered with over 17,000 grocery stores in the U.S., I'm proud to say, including Stop and Shop, where our customers can get 25% off the cost of fresh produce at grocery stores. They write at the cash register, they buy a bag of apples, present your Hancock card, and right on the receipt it'll say $5 bag of apples minus $1.25, John Hancock Vitality. So trying to make the right choice the easy choice. We have a game that our customers can play called the Vitality Squares, where they turn over little tiles. It either turns over something unhealthy, like a donut or a hot dog or what have you, or something healthy, like a fruit or a vegetable. The more healthy tiles you turn over, the more points you get, the more rewards you get. So I think the life insurance industry should be a prominent player at this table.
Sure.
We stand to benefit if people live longer, healthier lives, and nutrition is obviously a really prominent part of that.
Yeah, and that gamification of making the right choice, the easy choice, is really important. So Gordon and Chef Ismail, I want to talk a little bit about how stores and restaurants and culinary professionals can better partner with nutrition professionals to help you all access the resources that you need. So Gordon, do you want to go first?
Yeah, well, we have a team of dietitians. Most of them are sitting just over there. And they do a fantastic job for us. They're involved in actually our category planning, our category management. You know, are these products healthy to bring into the business? They're giving webinars and out there in the community working. Christine is in their Roxborough store and does a fantastic job there, an in-house nutritionist. So we have, you know, a lot of resources ourselves, but you know, I keep saying to everybody, look, we are desperate to partner with people. This is really important to us. As a food retailer, I think we have a requirement that we're involved in food as medicine. And the way I look at things is we have assets that we can use. So we have 60,000 people. We've got 400 stores. We have relationships with the biggest manufacturers in the country. And so what do you want to bring? I could offer that to you. What do you want to bring to work with us? What are your ideas? How can we sort of share our resources? And that way, I think, will make a difference, because there's a lot of really good people, a lot of good work getting done out there, but it's getting done in isolation. And I think if we can start joining the dots with all of these things, you know, the health insurance is a great example. You know, if you eat healthy, you're going to be healthier, you know, you're going to get a cheaper sort of insurance premium. And that's the sort of thing that we're open for.
Yeah, we've been hearing that all day, the silo breaking, the connecting the dots. Chef Ismail.
Yeah, speaking to some of the silo breaking, I can talk about two things.
Please.
In addition to Nubian Markets, I'm also leading work in Harlem with the Corbin Hill Food Project, and we actually have a NEFA grant of about $1 million to do food as medicine work in partnership with Harlem.
So cool.
and the Bronx. So
Yeah.
The original project was designed to actually make sure we're creating community council within the community. and not just an advisory board, but actual community council. As soon as you add council, that's decision-making that's happening at the community levels, and you're working with other organizations to design right from the beginning what the community would like to see.
Yeah.
And so that's one of the innovations that we're doing, and also making sure that the data stays within community, within our own version of a repository, so we know that the data stays within the community as well. And so that translates into something that we're beginning to do at Nubian Markets in partnership with Boston Medical Center as well, which is with Rewire Health. Well, I don't know if Olivia's in here, but anyway, but with a nutritionist and dietitian over at Boston Medical Center has designed an app to be able to have Nubian Markets hold the data that we are getting from the customers around like what's moving, what would they like to see, what changes needs to be made on our offerings, what are they cooking at home, what ingredients do we need to stock, and all that stays within our community and not within a construct of a space that's not owned by us. So that's how we're trying to break down the boundaries break down those barriers and those silos that you're talking about. It's really delivering the types of models that are completely owned by a community right from the beginning, and then working with partnership with anchors around us, so that we can create, Black and Brown owned anchors instead of anchors that are not owned by us in our community.
Sure. Round of applause for this, because it's such a great project. It's such a great concept, and it can be replicated in other communities, and that's what you're seeking to do.
Yeah, we put an S on the end of Nubian Market, so hopefully we can become many markets around the country, because if we don't have Black-owned businesses that are actually centering our Black products, right now in Nubian Markets, we have over 35 different Black-owned products that are produced and or grown by Black makers and growers in Massachusetts and around the country. And so then we can put like Sweet Baby Ray's, which comes from like Big Food, put on the bottom shelf, and put Hillside Harvest or Happy African Gourmet in the center of the shelf, prioritizing what we want to prioritize, which of course is our medicinal products that resonate with us in our communities.
Right.
So.
Absolutely. So critical. Thank you so much. Yes, please. So Pam, I want to go back to this business case that needs to be built when we're talking about, getting the private sector on board for this concept of food as medicine. And the business case is there, but there isn't always the sort of momentum we need. Kaiser's good at it, right? But how can we encourage others to be good at it?
I actually don't know that I agree that the business case is there, so I'd be interested to hear why you think that.
Yeah, of course.
Because I think it all, well, when I say the business case, I mean we have to figure out which, this is what I said earlier, which disease categories, which target populations, and which duration, so that when, for example, when you're deploying an 1115 waiver, you have some choices. You have some choices in which disease categories, which populations, and we have, just as an example, we have 1.3 million Medicaid members. So if you multiply 6 months of produce prescriptions times 1.3 million, that's a lot of dollars. How do you build the business case for the most effective interventions that get to at the end of the day, everybody, I think, wants the same thing, and that's healthier lives, better well-being, lower chronic disease, and all the stats that we saw earlier. And we also know that our members are struggling. We've surveyed them even as recently as just a few months ago, and we asked our members about their social needs, and what we saw was almost a little over 2/3 of our members said they had at least one social need. So food, housing, transportation, those kinds of things. 2/3 of our members had at least one, and 20% had 3 or more. And if you look inside the Medicaid population, it was 90% had at least one social need. If you look at food and nutrition insecurity, we saw 25%, so higher than the national, depending on which data you look at, of what Dari showed on his slides. That's a lot of people that are struggling, and so how do you target that? And so that's what I mean when I say business cases. I mean like what should be deployed, and how do you pay for it, and somewhere it has to you pay for it instead of what. So because we're a prepaid health plan, and that means you get money at the beginning, just like you, and we are incentivized to keep people healthy. So who should we focus on keeping? Who to focus on is really what I mean.
I think it's really easy to overthink these things and really get caught up in a business case. I can tell you, if I want to acquire another company or enter a new market, yeah, I've got to go to the board with a business case. But when it came to doing this vitality thing that I mentioned,
Sure.
I just got in front of the board and said, this is the right thing to do. Why would we not help people? And I think what you hear from everybody here is, yes, I mean, most of us are for-profit enterprises and so forth, but a strong sense of like values and conviction is what it takes to get these things done. And I can tell you, I didn't a business case for this vitality thing. We spent tens of millions of dollars on it, and the return has, turns out, thankfully for me, been phenomenal. But or I wouldn't be here today. But it is easy to overthink it. Like, shouldn't a life insurance company want people to live long, healthy lives? Shouldn't a health insurer want people to be healthy? I mean, all the values represented here. So I think this type of work starts with like values and conviction, and the business follows.
I love that we're looking at the sort of moral part of this instead of just the dollars and cents part of it. And so from Stop and Shop's perspective, I mean, you're a company that needs to make money too, but you also see the moral side of this.
100%. Yeah, we've supported food banks for decades. You know, we've been involved in the food industry over 100 years. So, you know, it's just the right thing to do. You know, you get to the point where you know, we have a responsibility to stop food waste. How can you stop food waste? You give it to people who are hungry. And last year we donated over $40 million in food to good causes. So, you know, it just makes sense.
Thank you all so much. The private sector certainly has a responsibility, and thank you all for like living up to it. I really appreciate talking to all of you. Please give them a round of applause.
Thank you.